of the Center for Rural Pennsylvania, as well as members of the public in the audience. I thank you very much for the opportunity to allow the Office of Attorney General to share our perspective on this epidemic of heroin and the tragedies that result therefrom. We're also going to be talking about prescription opioid epidemic in Pennsylvania because they are becoming now one problem. And the proactive measures that we at the Office of Attorney General are taking to combat this proliferation of drugs in our Commonwealth. As you already know, heroin has replaced cocaine as the drug of choice in Pennsylvania. The majority of our statewide cases handled by our Bureau of Narcotics Investigation are heroin-related. In 2013, DNI made 1,376 arrests. 522 of those arrests involved heroin. 473 of the 875 arrests that the Bureau made so far in 2014 are heroin-related. Many others are polydrug cases or cases where heroin is accompanied by a combination of cocaine, meth, and marijuana or prescription drugs. You probably already noticed that heroin is extremely easy to obtain in Pennsylvania and throughout the northeastern United States. This is due to the great measure of the increased production of heroin in Mexico and the transportation of huge quantities across the southwest border. I and members of the Bureau of Narcotic team took a trip to the southwest border because we believe that a safer border is a safer Pennsylvania. There is a direct route from Mexico up to either California, Arizona, Illinois. It's repackaged and transported directly then to Pennsylvania. In the 1970s, heroin was 2 to 3%, had a 2 to 3% purity. Now there is a 70% purity of this drug. The wholesale purity is 87 to 90%. That is extremely high and extremely dangerous. Mexican-produced heroin is becoming purer and the prices are becoming lower as we see the Mexican drug trafficking organizations have established a market and foothold in this Commonwealth. Prior to a few years ago, the Mexican drug cartels stayed west of the Mississippi, but because of the marketability and the opportunities here in the Northeast, the market has now opened up in the northeastern part of the nation. According to the U.S. Drug Enforcement Administration's National Drug Threat Assessment for 2013, Mexican transnational criminal organizations represent the greatest organizational drug threat to the United States. The Police Executive Research Forum, or PERF, has focused on heroin as an epidemic at this point, and that is an organization that brings about all the police chiefs and the federal authorities to talk about the topics that are most important in the nation now. Mexican TCOs are the predominant transporters of wholesale quantities of cocaine, heroin, meth, and marijuana to the U.S. markets. Pennsylvania is considered both a destination as well as a source of heroin coming into the region. In the past, drug trafficking organizations and associated street-level dealers were insular in nation and more easily exposed by law enforcement. But today, because of the structure of the drug trafficking organizations, particularly the Mexicans and the Dominicans, these cartels have effectively co-opted the organic-level, street-level distributions, street gangs, and prison gangs, which makes them harder to detect. The local networks often have several degrees of separation between the cartels in Mexico, and law enforcement usually views this local threat as nothing more than just that, a local threat. Our assessment of the presence and operational capability of the Mexican cartels in Pennsylvania is based upon our intelligence, cases we're prosecuting, and our state and federal partners' concurrence. The cartels have the ability to project their influence, control, and intimidation over great distances. Competition for profitable drug markets often results in homicides, shootings, arsons, assaults, robberies, as dealers fight over territory, intimidate rival dealers, witnesses, and the neighborhoods. The Office of Attorney General has successfully arrested and prosecuted cases with direct ties to Mexican cartels. Our investigation is ongoing, and we know that these cartels maintain a strong grip over drug trafficking and money laundering activities in Pennsylvania. Within my office, I've tasked BNI with addressing the heroin epidemic's growing problem in a holistic, comprehensive manner. OAG is building a robust intelligence analyst capability, Whereas before we had perhaps one analyst, now we are up to 4, and we have also borrowed 2 analysts from the National Guard. These analysts will allow us to look at the state as an integrated enterprise, not just dealer by dealer and not just neighborhood by neighborhood. Collect relevant law enforcement information from all sources and put a substantive meaning to that information in order to inform all of the stakeholders, such as forums like yours. Most importantly, we seek to let the public know, to the extent that we can, the measures that we're taking to ensure their safety. We also seek to work better with our federal partners and our local partners. As you well know, Senator, resources are stretched throughout the Commonwealth. Local police forces are stretched thin, state police, state resources, and federal resources. And we know now, not like years past, that unless we work together, we will not be able to combat this problem. We also know that because of jurisdictional limited capabilities and limitations amongst local police, state agents, state police, and federal agents, we must work together. This is no longer a neighborhood problem. This is no longer just a corner problem. The local police only have jurisdiction within their boundaries, but we also know that we must trace back those sources. We can't just take the dealer off the street. There's 10 more dealers right behind him. There's 20 more dealers right behind him. The quantities are so large, the Mexican drug cartels are now fronting the drugs to the dealers. And what that means is instead of giving the drugs to the dealers, expecting payment at that certain point in time, they are now fronting the drugs. They're giving large quantities right to the dealers. The dealers mass about, it depends on the dealer, but sometimes $100,000 worth going out and selling it, and then they meet back up with the supplier and pay them at another time. The Mexican drug cartels are also not worried about losing their load. And that means that if law enforcement interdicts those sources or those huge quantities of, say, heroin or meth or cocaine, they have plenty more where that came from. So fronting the drugs is not a problem to them any longer. When we went on our southwest border trip, we went with the Border Patrol, and we saw large, unbelievable quantities that are seized coming across the border. Unbelievable quantities. And then they told us that they estimate that that's only 40% of what actually makes it across the border. And it's unbelievable. It's staggering. We believe that now we have to have innovation and we have to have collaboration. Our interdiction efforts, we work with the U.S. Postal Service, border crossing, toll patrols, and commercial shippers such as UPS and FedEx, which now are getting unwittingly involved in the transportation of drugs. It even includes hotels in which drug traffickers are known to operate out. Whether a shipment of heroin is intended for Pennsylvania or passing through the state for another regional destination, we have a vested interest in interdicting that cargo or the money that's going back in return, determining its source and its destination. We must collaborate with the other states, which we do, transshipment cities and states, and border states, and it's critical to our ongoing efforts to stem the rate and the volume of drugs flowing into Pennsylvania and the money that flows back out. Heroin-related overdose and overdose deaths are on the rise in the Commonwealth. Pennsylvania has the 3rd highest number of heroin users, behind California and Illinois, with an average of 40,000 heroin users. In 2012, there were 329 overdose deaths in the 48 counties that reported fatal overdose data. Victims ranged from 19 to 86 years old. The number of heroin users is on the rise in part because first-time users are getting younger. In 2011, the national average age for initial heroin use was 22. In 2010 in Pennsylvania, heroin was listed as the primary substance of abuse among 20 to 29-year-olds, followed closely by prescription drugs. Now the average age, instead of 24 and a half, is now down to 22. And we've seen first-time users as young as in their teens, early teens. Prescription drug abuse, as you well know, is tied into heroin abuse. We're seeing a collaboration among prescription drug abusers and heroin use. In many cases, the dependency on prescription pills becomes prohibitive because of the expense. A typical prescription is $30, where they can get heroin in some regions in Pennsylvania between $8 and $10 a bag, whereas it used to be between $15 and $20 a bag. Now it's much lower, it's much purer, and the availability is much higher. Pennsylvania has seen a rapid, significant increase in prescription pill abuse, overdoses, and overdose deaths. A study released over the summer indicated that Pennsylvania, which once had the 14th highest drug overdose mortality rate, now is 7th in the nation. And that's according to a DEA report from just 2013-2014. In addition to illicit trafficking of pharmaceutical drugs, otherwise legitimate prescriptions, particularly opioid, narcotic, analgesics, are likely obtained and either used directly or sold for illegitimate use. Unscrupulous physicians or their staffs sell or barter prescriptions. At the Office of Attorney General, within our Bureau of Narcotics, which has 8 regions spread throughout the state, we have a diversion unit, and that diversion unit is aimed specifically at targeting doctors who overprescribe, nurses, pharmacists, and healthcare facilities. Since January of 2013, OAG has participated in a number of investigations and arrests against doctors for participating in prescription drug abuse. One of those cases, unfortunately, was from my home county, Lackawanna County, where a physician was prescribing practices led to multiple overdoses, including her daughter, as well as the death of a 52-year-old male patient. She's the only doctor that we know of now to be charged with homicide in relation to her prescription practices. We at the Office of Attorney General are not just interested in data. I always find that think tanks sometimes have a lot of information, but that information never gets boiled down into a practical use and then hits the streets. I think forums like yours bring that right down to the streets and practical solutions. We need to take necessary measures to combat the prescription drug epidemic and the heroin epidemic, and part of that is legislative. We at the Office of Attorney General have been working with the legislature on the prescription monitoring bill, and that would allow the law enforcement to have access not just to Schedule 2 information, but as well as 3, 4, and 5 with a court order, and then that information cannot be used in a trial. So it protects the privacy of the patient as well as is a great tool for law enforcement in seeing these patterns of overprescribing. It also allows the doctors to perform their job. It allows them to see whether a patient has gone down the street to the CVS and just filled a 30-day prescription for, say, OxyContin, and then a day later is now going to their pharmacy. It allows them to see that there may be a problem. And part of that also allows us to get that person's help. We believe that the three-pronged approach to solving or lessening or making people's lives a little bit better related to prescription pill abuse and the heroin epidemic is just that. It's education and prevention. Then it's enforcement, and then it's treatment. And we have to keep going on that three-pronged approach. If one of them fails, we all fail. If there's no education and prevention, then law enforcement's job is not what we want it to be. We don't need any new customers. We're not interested in making as much arrest as we can. We're interested in making sure that the public is safe. And because of that, we have an Office of Education and Outreach. Last year, they gave 524 drug presentations to schools, to children, to parents, to faculty, and to the public. They educated over 84,000 people. And that's great. But there's 12 million people in Pennsylvania. We can do what we can do. And forums like you do what you do. And it's very important because now kids don't even see that prescription drug abuse is a problem. Because it's a legitimate script, they don't see it as a problem. They also don't see that trying drugs every now and then is going to be addictive. They just don't see that anymore. And that's why they're getting younger and younger, and that's why the abuse is going higher and higher. So we believe in prevention and education. We believe in enforcement. That's why we are spread throughout this state with our 8 regions. That's why we work well with all of our federal partners and our state partners. That's why we put together the Mobile Street Crimes Unit with the help of the legislature, because we believe that we have to start saturating these areas. We have to start combating the gang-related problem with the drugs. We have to start taking them off the street, but we have to also start dealing with the users in a different way. And we do that. We now have a program within our Bureau of Narcotics that takes some of these kids, some of these users, who we think that we can save, and we get them the treatment, or we point them in the direction of the treatment that they need. And once they come out, we give them the support that we hope that they need, and they start helping us. They start going to the schools. They start talking to these kids. They start saying, look at me. I was a regular student. I was just like you. All I did was take the pills out of my mother's cabinet. I was addicted, and then I turned to heroin. And these kids have to see that. We also have started a program working with the schools to put together almost peer groups. So we'll take some of the kids from the high school and we'll say, tell us what you're hearing, tell us what you're seeing, and better off, tell us how we can communicate better with these kids. I'm 48 years old. I have no idea how to use half the technology that my kids know how to use. I don't learn the same way that they learn. They're very digital. They're very technologically savvy. Everything is, you don't get them in 15 seconds anymore. You're done. So we have started educating ourselves to better educate them as well. Our Mobile Street Crimes Unit has done an unbelievable job. They're on their second deployment now. The first deployment was in Hazleton. And because of that innovative approach, we took 35,000 bags of heroin off the street of Hazleton. There are only 33,000 people in Hazleton. And it's an amazing success, I don't think just because of the stats, but I think because the people of Hazleton gathered together the last night of the deployment, and they were at a forum just as yours. It was a community meeting, and I've never seen so many people at a community meeting. And they said that they knew we were there because they felt some sort of peace. They saw the increased presence. They saw that their communities were getting a little bit more peaceful. And to me, that's what our job is. The national trends are forecasting that meth continues to be more prevalent, that opioid use and heroin is the biggest problem, and that we must start working together to prevent it. I appreciate all that you have done. I appreciate all that, Senator, you have done in granting the Office of Attorney General the money that we needed, but there's so much work that needs to be done. I appreciate being here because I think that it's so important to inform the public. We have also revamped our website at the Office of Attorney General because I, as a parent, if I didn't work in my job, I would never know what a heroin bag looked like. And if I was going through my son's backpacks, I would miss it. It's marked with it could have a canned stamp on it, and I wouldn't know what it was, and I wouldn't get them help. So we need to start educating parents as to what they can do. This starts at home. It goes out onto the streets, and it expands into the national and the international level. And I think groups like yours are tremendously important to that education, the enforcement, and the prevention. So at this point, I'll take any questions that you have.
Thank you, General Kane. I understand funding is always an issue, but aside from funding or an increase in funding, what tools would the legislature provide you, whether it's, I don't know, stronger sentencing regulations, mandatory minimums? If you had to pick any of those things that the legislature could do to help you or to give you more tools to operate in, what would it be?
I would probably pick two things. The prescription monitoring, the prescription pill monitoring system is a tremendous tool to law enforcement, tremendous. I know there were many amendments, but the one that I believe is in the Senate, I believe is going to be the best. We need to make sure that law enforcement has access to 2, 3, 4s, and 5s, not on a probable cause standard, but on a reasonable suspicion and then obtaining a court order. Quite honestly, if we have probable cause, we're not going to need to get into that monitoring system. It's already too late, and already somebody has died, and already the problem is in the street. This is a preventative measure, and I think it's going to be an excellent tool. But the other thing is, quite honestly, just like I said, we don't need any more business. I believe that the legislature should help the treatment programs, because once a user goes into jail, I could put them in jail, but I know that once they serve their minimum sentence, they're coming back out and they're still a user, and we're going to see them again and again and again. And until they get treatment, we're not going to break that cycle.
Thank you.
Thank you. Welcome to Clarion, the community, and question I have is, in your thoughts, do you have any hopes or thoughts regarding the higher education community? Because you said that we've heard a theme here that we can't arrest our way out of this problem, that you're busy enough in your work and you would like to not, get any busier. So we're in the business of human development, preparing people for future careers at the Commonwealth. Any thoughts or comments on how public higher education or all of higher education would be helpful to the problem?
Higher education actually is very helpful to us now. We've reached out to a number of universities to ask them to conduct some studies. If they have a behavioral health class, help us understand where addiction begins. Help us understand where that break is between when children have meetings and then they're an addict. Show us where that happens. And your behavioral health classes can do that for us. Show us the technology and the communication. Show us how we can reach them better. Your psychology department can do that for us. You can educate us. But you're also, I think, you can be great mentors. You have kids students at a level that are much closer to the teens and the 20s that we're seeing who typically abuse heroin or prescription pills for the first time. If you have mentoring programs that went out into the schools and talk to kids or give them something to do other than get involved in drugs, other than, or even go out and spot children who may have an addiction problem. I heard Gary Tennis talking about how parents have a tough time talking to their children. And, most of us are parents. We do have a tough time talking to our children. But younger generations, they don't have a hard time talking about that. I think they would be better communicators, and I think that they would be a great help to the community. I know that certain schools have to do community service events, things like that. If you can set up mentoring programs and go out and reach these people, reach these students, reach these users, reach the parents, then you would be helping us to do our job, and it would be in the prevention category. And I think that's where you could be useful, as well as in the analysis and the information and the intelligence that we need to do our jobs better. Thank you.
Representative Marabito.
Thank you for coming, Tim. There's a supply and demand side, and I think what I hear you telling us is that the demand side can be approached with treatment. And I think, I've been to a lot of these hearings, but I think I haven't yet connected what you just said, and I appreciate you saying that. That is one way to end the demand side. On the supply side, you alluded to a lot of different ways that the drugs are coming in. Do you have any numbers? I am just amazed that, what percent are coming in by mail, by car, by truck, by air? Do we have any figures on that? And what can we do in the legislature without obliterating people's civil liberty? Because obviously we don't want to throw the baby out with the bathwater. But what do you find in that area?
The majority of the transportation is coming in through trucks. Now, I know my husband will not be very happy that I'm saying that, since they own a trucking company, but that is the majority is coming in through trucks. They have sophisticated compartments. They take out the dashboard. They shove many bricks of heroin within the dashboard or the money. That's the majority. The second is coming in through air in Pennsylvania and trucks, because we have a great transportation system here in Pennsylvania. The second easiest way and the second largest way is by air. We have a number of airstrips in Pennsylvania that sometimes are unmanned. I fly into them myself sometimes. There's no control tower. There's nobody there when you get there. It's very easy to do. The third way, and commercial air is now becoming very popular as well as the mail. It's incredible that they're getting it in through the mail. But that's the majority of the ways. Now, the way that we are solving, or we're trying to combat that, is through our interdiction program. So we work well with the intelligence community. We work well with the other states. And they will say, you have a load coming through Pennsylvania, it's on its way to New York. You'll see it somewhere around, this time at night, and then our state troopers are on those highways, and they're able to make sure that they can spot that vehicle, and then they're able to pull the vehicle over, and we can seize the drugs or seize the money. And they usually don't have both together. It's usually the drugs in one vehicle, and then the large, unbelievable amounts of money in another vehicle. So our interdiction program is, I think that of course, it's not enough because you need boots on the ground for that. But it's getting there. And the intelligence that we're building up, and the fact that we're working better together, and the information silos are breaking down. normally the DEA and the FBI would never give the locals any information or never give the state any information, and everybody was very protective of their information. That's not the way it is anymore. We know that if it's going to New York, let them go and get it. It's not a territorial problem anymore. So the informational silos that are breaking down also help us with that. But the boots on the ground is the best way to do it. We need the troops.
Two last questions. If a majority is coming in by truck, and we heard testimony from law enforcement folks about cutbacks in rural Pennsylvania in terms of the number of state troopers. And also we experienced in our own community moving of this aviation unit, the helicopter aviation unit. Would it help to divert more resources into troopers in rural Pennsylvania, into more aviation units in rural Pennsylvania? Would any of that help?
It would help. We're in every county in Pennsylvania. So we have 8 regions. Our regions cover every single county. So that it would help, not just to us, but to PSP as well. Because you do have to have that, you have to have the eyes and the ears. But what would also help is if the units that you do have, the local units, even if they don't have the manpower to stop a truck, because it's dangerous, it's a dangerous situation. If they're out on patrol by themselves, if we train them into spotting a potential problem, and then we give them a place to call OAG or call the state police, then they would be a great tool to help. So we need the training for the local police, and then we would need more agents and troopers on that.